Please start, Dr. Isma. It's recording.
Research Ethics by Dr. Ismaili. Bismillahirrahmanirrahim. Quote of the day. Ethics is knowing the difference between what you have a right to do and what is right to do. Learning outcomes. Learning outcomes of the presentation are introduction about research ethics, importance of research ethics, ethical guidelines, and medical ethics about research. Learning outcomes. At the end of this presentation, participants will be able to describe about introduction of research ethics, guidelines of research ethics, and ethics of medical research. Introduction. Research ethics are defined as guidelines for the responsible conduct of biomedical research, including safety of the researcher, subjects, and contributing to the good of the society. Research ethics also educates and monitors scientists conducting research to ensure a high ethical standard. History. The first attempt to craft a regulation based during the doctor's trial of 1946 to 47. The doctor's trial was a segment of the Nuremberg trial for the Nazi was a war criminal. In the doctor's trial, 23 German Nazi physicians were accused of conducting torturous experiments. The accused physicians tortured, brutalized, and murdered thousands of victims in the name of research. Some of the experiments involved gathering scientific information about the limits of human body by exposing victims to extreme temperature and altitudes. The most destructive experiment tested how quickly humans could be euthanized in order to carry out the Nazi racial policies most efficiently. Ethical guidelines. The Nuremberg Code was constituted to prosecute the accused Nazi doctors for the atrocities they committed. It is the list of ethical guidelines for the conduct of research and consists of 10 basic principles. Next major initiative designed to promote responsible research with human subject was called the Helsinki Declaration. The Helsinki Declaration contains all the basic ethical elements that are specified in the Nuremberg Code, but then advances further guidelines specifically designed to address the unique vulnerabilities of human subjects sized to participate in clinical research projects. Following the Helsinki Declaration, the next set of research ethics guidelines came out in the Belmont Report in 1979 from the National Commission for the Protection of Human Subjects of Biomedical and Behavioral Research. The Nuremberg Code, Helsinki, and Belmont guidelines provided the foundation of more ethically uniformed research to which stringent rules and consequences for violation were attached. The Animal Welfare Act provides guidelines and regulations for research with animals. IRB, Institutional Review Board. The Protection of Human Subjects Regulation outlines the purpose and policies of IRB, oversights and approval, informed consent and protection, and policies for research with children, pregnant women, fetuses, prisoners, and mentally incompetent individuals. There are several avenues for people who wish to seek education on basic ethical principles. The University of Minnesota's Center for Bioethics and many other universities and professional institutes around the country are continuously offering education for researchers and scientists on ethical research issues. Values in medical ethics. Six of the values that commonly apply to medical ethical discussions are autonomy. Autonomy is that the patient has the right to refuse or choose their treatment. Beneficence. A practitioner should act in the best interest of the patients. Null maleficence. The purpose of the null maleficence is that the patient should be safe and first do not harm the patient. Justice concerns the distribution of scarce the health sources and the decision of who gets what treatment. Dignity. The patient and the person treating the patient have the right to dignity, truthfulness, and honesty. The concept of informed consent has increased in importance since the historical events of Doctor's trial of Nuremberg trial and the Tuskegee syphilis study. Importance of research ethics. All the researchers should be familiar with the basic ethical principles or have up-to-date knowledge about the policies and procedures designed to ensure the safety of research subject to prevent sloppy or irresponsible research, because ignorance of the policies designed to protect research subject is not considered a viable excuse for ethically questionable projects. Research is a public trust that must be ethically conducted, trustworthy, and socially responsible if the results are to be valuable. All parts of the research project, from the project design to submission of the results for peer review, have to be upstanding in order to be considered ethical. When even one part of the research project is questionable, all conducted unethically, the integrity of the entire project is called into question. Examples of unethical research. Uh, Tuskegee experiment, 1932 to 1972. American researchers purposely withheld treatment for 399 African American people with syphilis for the sole purpose of studying the long-term effect of the disease. William Brooks study, 1963 to 1966. Children with the developmental disabilities were deliberately infected with hepatitis. Some were even fed fecal matter. Purpose of the study was to examine the course of the disease and to test the potential immunization. Milgram's obedience study. Researchers asked participants to pseudo-shocking Confederates in order to examine obedience. Zimbardo's Stanford prison experiment. In 1971, the study had to end prematurely because of abusive behavior generated in participants who were assigned as guards over those subjects who were assigned as prisoners. Research ethics. Following the research ethics, the most important are: save the vulnerable population, avoid an exploitative transaction, research fraud and authorship, ethical guidelines for authorship, ethical guidelines to avoid fraud, guidelines for peer review, guidelines for conflict of interest, ethical guidelines for research misconduct, medical ethics. Save the vulnerable population. There is always an ethical concern when recruiting from vulnerable populations. Vulnerable population are the people who are poor, homeless, mentally ill, terminally ill, prisoners, students, and staff. Avoid an exploitative transaction. An exploitative transaction is one in which a person A takes unfair advantage of the person B. Research, fraud, and authorship. It is the process of deciding whose names belong on a research paper. Responsible authorship practices are an important part of research. Reporting and analyzing results is the key to applying research findings to the real world. Despite the challenges, researchers should familiarize themselves with proper authorship practices in order to protect their work and ideas while also preventing research fraud. Ethical guidelines for authorship. Each person listed as an author on an article should have significantly contributed to both the research and writing. In addition, all listed authors must be prepared to accept full responsibility for the content of the research articles. The International Committee of the Medical Journals is the recognized international expert organization when it comes to guidelines regarding biomedical research authorship. Who can be a co-author? A co-author is someone who has contributed substantially to the research, wrote or revised all or part of the manuscript, approved the final version of the entire article. All the contributing co-authors of an article must jointly decide the order of the listing of the names. The first person should be the one person that is most closely involved with the research. Ethical guidelines to avoid plagiarism. Plagiarism is the act of passing off somebody else's ideas, thoughts, pictures, theories, words, or stories as your own. If a researcher plagiarizes the work of others, they are bringing into question the integrity, ethics, and trustworthiness of the sum total of his or her research. In addition, it is both an illegal act and punishable, considered to be on the same level as stealing from the author that author has originally created. To avoid To avoid unintentional or accidental plagiarizing of another person's work, use the following tips from the Northwestern University website. Cite all ideas and information that is not your own or and is not common knowledge. Always use quotation marks if you are using someone else's words. At the beginning of the paraphrase section shows that what comes next is someone else's original ideas. These points started by saying that information originated from Northwestern University. At the end of paraphrase section, place the proper citation. Redundant publications. It constitutes a special type of plagiarism. The ICMJ defines redundant publications as follows. The redundant or duplicate publication is the publication of a paper that overlaps substantially with one already published. Peer review. It is the process in which an author or authors submits a written manuscript or article to a journal or publications, and the journal editors distribute the article to experts working in the same or similar scientific discipline. The experts, otherwise called the reviewers, and the editors then enter the peer review process. Ethical guidelines for peer review. The two most important ethical concepts in the peer review process are confidentiality and protection of intellectual property. The reviewers should not know authors, and the authors should not know the name of the reviewers. Peer review, in addition to maintaining confidentiality, can be neither conflicted nor critical in the review. Editor of the journal should maintain an open and ethical peer review process, and all submitting authors and readers should be fully aware of a journal's process of peer review. The peer review process represents one step in the publishing process, and the editors need to take full responsibility for their decision to include an article in their journal. Editors should include articles that they believe to be honest, accurate, ethical, and scientifically responsible. Conflict of interest. It arises when a person's or an organization's obligation to a particular research project conflict with their personal interest or obligation. It is particularly important to examine within the context of biomedical research because research subjects may be particularly vulnerable to harm. Ethical guidelines for conflict of interest. The objectivity in the research NIH guidelines, National Institute of Health guidelines, provides guidelines on how investigators receiving grant from the National Institute of Health should handle conflict of interest. Physician and the other healthcare professional researcher may find themselves facing conflict of interest in their duties towards research versus their duties towards the health and welfare of their patients. Clinical and obligations to a patient should always be considered above and beyond the obligation of research. Ethical guidelines for data management. There are three issues: the ethical and truthful collection of reliable data, the ownership and responsibility of collected data, retaining data and sharing access to collected data with colleagues and the public. Assigning and ensuring responsibility for collecting and maintaining data is one of the most important ethical considerations when conducting a research project. NIH guidelines on data sharing are: the primary guideline states that all data must be shared and released in a timely manner, and NIH defines timely manner as no later than acceptance for the publication. The Health Information Portability and Accountability Act, HIPAA. It provides the ethical guidelines about the data sharing and using data containing personal identification information. The HIPAA guidelines protect personal health information and provides legal requirement for all segments of the healthcare system, including biomedical research, concerning what type of information can be stored and protected, data coding, and how information is used. Ethical guidelines for research misconduct. Any person who knows that the research is being conducted unethically should raise his or her concern to the appropriate authorities, whether that person is involved in the research or not. The first step that is most likely should be taken is confidentiality. Confidential conversation with the person that is in the charge of research integrity at any research institution. Once the research misconduct is identified, all parties that are involved in the research should take full responsibility to resolve the situation, including the principal investigator, the co-investigator, institution hosting the research, the funding agency, and the publishing journal editors if applicable. Research with the animals. Animals are used in a variety of ways by researchers, such as for testing new pharmaceuticals as a teaching tool for new surgical procedures. Research with animal is necessary first step towards the research and is frequently involving new medical treatments and pharmaceuticals that are intended for human use. Ethical guidelines for animal research. In order to prevent the mistreatment of animals, the United States government first passed the Animal Welfare Act in 1977. It exists in the order to ensure that animals taken for research purpose are provided human care and treatment, to assure human treatment of animals during transportation in commerce, to protect the owners from the theft of their animals by preventing the sale or use of animals which have been stolen. Research with human subject. Most important contents of the research with human subjects are respect for person-informed consent. Informed consent means that the people approached and asked to participate in a research study must know what they are in getting involved with before they commit. Need to be they should not to be manipulated in any way to participate. They must consent to participate in the project as a subject. Respect for person privacy and confidentiality. Privacy and confidentiality are very important components for research involving human subjects. Genetic information may violate a person's right to privacy if not adequately protected. For example, breast cancer, a researcher will inevitably collect a wealth of the other identifiable information that could potentially be linked to a research and participant as well. Medical ethics. History. In the medieval and early modern period, the field is indebted to Muslim physicians such as Ishaq bin Ali Rahawi and Muhammad ibn Zikriya al-Razi, and Jewish, Catholic, and Thomas thinkers. Components of medical ethics are Declaration of Helsinki, Oath of Hippocrates, Physician's Oath, Confidentiality in Research, Consent in Research, Informed Consent, Consent for Medical Procedures, Coercion, Inducements, and Exploitations. All these points are explained in the next slides. Helsinki Declaration. The Declaration of Helsinki is named after the geographic location where the document was drawn up, Helsinki in Finland. Basic principles of this are respect for the individual, right for the individual's right to make determination and make informed consent. Individual's welfare is most important. Ethical consideration must always take precedence over laws and regulations. If an individual is minor and not able to give consent, the consent should be taken from the guardian. Confidentiality in research. All information collected in a research project should remain confidential and assigned a HIPAA compliant code. Data should be logged away in a secure setting. Electronic databases should also be protected. Consent in research. Defined as concurrence by a party with an action to be taken by another party. Informed consent. It includes description of the nature of the research, statements that the research is voluntary and participants can withdraw anytime, identification of risks and benefits, description of confidentiality protection, description of compensation, description of what information will researchers share with the participants, identification of who will be responsible for research with contact process. Consent for medical procedures. Consent for the use of body tissues, organs, fluids should be taken from the person. And if the person is dead, that consent should be taken from the guardian or the next immediate person that is most likely involved or relevant. Donation of the blood, semen, bone marrow, kidneys should be done after taking consent always. Characteristics of voluntary informed consent: legal capacity, physical and mental capacity, scope of action, who may take such actions, freely given, variable, over what time period does it apply, delegable. Coercion. Coercion. It can occur when an overt threat of harm is intentionally presented by one person to obtain compliance from another. Perceived coercion in research can occur with prisoners, students, and staff. Payment for research is an offer, it's not a threat. Inducements. This is the offer that gets people to do things they would not otherwise do. It may be acceptable inducements or undue inducements. Excessively attractive offers that lead people to do something to which they normally would object based on risk or other fundamental values. Exploitation. An exploitative transaction is one in which person A takes unfair advantage of the person B. The examples of the exploitative research are as follows. The intrepid guinea pig of the Great Lakes in accidentally shot in the gut and left with a permanent gastric fistula. William B. Mont paid his room, board, and won $50 a year for the use of his stomach. Walter Reed's yellow fever study paid $100 in gold for participation, $100 bonus for successful infection with yellow fever, and payable to family in the event of death. Now comes the MCQs. Which of the following is the most updated guideline about research ethics? Nuremberg Code.
Belmont report.
C is the right answer. Belmont Report in 1977. Nuremberg Code was the first one to design. After that, Helsinki Declaration was done, and after that, Belmont Report was made. A patient is having breast cancer, reports to a surgeon. The practitioner wants her to be a volunteer for research process, but the patient is refusing. The researcher should force her to participate. The researcher should respect the patient's choice. Patient should be refused from treatment. Confidentiality can be broken for students' benefit.
B.
Yes, B is the right answer. Researcher should respect the patient's choice, and confidentiality should not be broken even for D option. The two important components of the research responsibility are sincerity in work and avoiding plagiarism. Writing the thesis.
Plagiarism.
Yes, plagiarism is the right answer. Which of the following options most appropriately explains research ethics? It states how to write a research report flawlessly. It gives the methodology of research within social norms. It governs the prevention of plagiarism. It provides a common set of do's and don'ts of conducting an ethical research.
B. D.
D is the right answer. Which of the following needs to be obtained when doing a research with children? Informed consent from the parent or guardian. Do not ask from the children even if he or she is capable. Informed consent from the child, and only father can give consent.
A.
A is the right answer. Which of the following is not an ethical guideline for conducting research with humans? Getting informed consent of the participant, telling participant they must continue until the study has been completed, keeping participants' identity anonymous, and telling participants they are free to withdraw at any time.
B.
B is the right answer. that participant can withdraw anytime. It is not necessary for them to continue until the study is complete. Research participants must give what before they can participate in a study: guidelines, commitment, informed consent, or private information.
D,
C.
Informed consent. They should all be given informed consent. IRB is an acronym for which of the following: Internal Review Board,
E,
Institutional.
C.
C is the right answer. Institutional Review Board. What is it called when the participants are not revealed to anyone but researcher and staff? Confidentiality, anonymity. Confidentiality is the right answer. What is correct regarding peer review? It is a minor part of scientific review. It does not involve much time. It is done to uphold the quality of research, and it should never involve more than 4 people.
C.
C is the right answer. It is done to uphold the quality of research. This is the key. This is the reference of my slide, and thank you.
Thank you very much, Dr. Isma. The first thing that I want to mention is that you have to share your presentation a day before and you haven't. So please, for the next time, I would be looking forward that you should share your presentation first so that I can comment on it. Second important thing is that it is an overview, so you have touched all the things very briefly. However, there are more discussions that are required. For example, when we are talking about the case scenarios, there are many case scenarios and how the ethics have been breached in that particular scenario. It has to be discussed in detail. You have talked about different studies, right? Yellow fever study and other studies. For each study, you have to give the scenario in your next presentation, and after that scenario, the further discussion would occur according to the principles of ethics. We all know that there are 6 principles of ethics. One is autonomy. The 2A and 2B is 2A is beneficence, 2B is non-maleficence. Then we have equity, justice, veracity, confidentiality. So for each and every principle, you have to give this important scenario and how and what principle has been breached. We have to discuss it further. For example, yellow fever, what has been the dilemma with the research ethics? Number first, autonomy. Is there any respect of the individual? Is there any voluntary involvement of the individuals? Are they allowed to withdraw at any time? Is there any thing that is related with their human rights? So this the second important discussion would be about beneficence. How those people who were given the yellow fever or who were followed for the history of the yellow fever, national history of the yellow fever, how they were benefited, or uh, it was really harmful for them, how their families they suffer, how they themselves they suffer. So each and every principle has to be discussed in the scenario of that particular disease. So for the next of your presentation, I want you to just present a scenario, then you have to give the principles of ethics, and each principle has to be discussed in detail in your presentation, that this is the principle
Alright.
autonomy. These are the important points. These points were not followed. These points should be followed, and it should be ethically not permissible, or if it is permissible, then how and why. The second important thing is you have touched the important human aspects of the ethics, the animal aspects of ethics. You have mentioned different declarations. However, there should be a complete presentation on Nuremberg Code. There should be a complete presentation on Belmont Report. What are the differences between Nuremberg Code and Belmont Report? There should be a complete presentation on Helsinki Declaration, how the Helsinki Declaration changed the whole perspective of ethics. What is the importance of Helsinki in the today's ethical considerations? How the IRB has the foundation of Helsinki Declaration. Then we have the World Medical Association And the World Medical Association is continuously revising the ethical considerations. The one presentation should only be on World Medical Association ethics, how they have been developed over the years, what were the different considerations that made them to revise, and how many revisions have taken place till date. Then comes the next important thing, that is plagiarism. I would request that on 1st May, we would have a complete presentation by Dr. Avais on plagiarism, because the plagiarism and the different examples of plagiarism, what are the different types of plagiarism, what is Islamic slice says, how the plagiarism is intentional, unintentional, uh, how we differentiate between them, what are the major minor penalties for plagiarism, how the plagiarism is different from the other types of research misconduct. So what are the different softwares that help us to detect plagiarism, how the authenticity of the plagiarized material is related with the actual material, how we have to give all those plagiarism or plagiarized articles the different penalties or punishments. And the research misconduct also include other parts of the different types of breach in research, trust in breach in trust in research. So all these things, they have to be discussed in much detail. So I would like that on first, the complete presentation of plagiarism, on types of plagiarism, the case studies in plagiarism, and how the plagiarism is different from the other types of research misconduct, that should be presented. Next important point that you have just touched and not have discussed in detail was about coercion. How the coercion occurs in the prisons, how the coercion occurs in different institutions, how the coercion occur in those settings where there is autocracy, how the different types of research misconduct are being governed by coercion. So the coercion, again, it is a very wide topic, how the coercion is different from inducement and from other types of research misconduct. So it is again a very lengthy topic. And in other book, that is a textbook of 20 medicine and public health, research ethics have been given in much more detail. If you go to a site of different websites, you can find the research ethical dilemmas. We all know that even Willowbrook study and the Tuskegee trials and all those studies, they have led to a debate, and that debate has led to certain types of conclusions that are now being considered in research ethics. Now, the next important thing is, whenever we are dealing with any research, how the informed consent procedure should be done. What are the differences between blanket consent and informed consent? How the patient should be recruited in randomized clinical control trials, what are the ethical conditions that should be fulfilled before having any randomized clinical control trial, how the registration on the research trial uh, should be made. Another important aspect of this is about the human ethical studies and the confidentiality